Hi, my name's Catherine Stannard. I'm a Quality Improvement Programme Manager for the Renal Association, and I'm here today with my colleagues Janine Hawkins, Senior Research Fellow at the University of Hertfordshire, and Claire Corr, who's a kidney transplant recipient herself and a Senior Research Scientist at the University of Leeds. So the title of this presentation is What Matters Most to People Living with Kidney Disease. And there are lots of different aspects of the quality of care people receive that are important to them. But what we're going to focus on today is how people experience that care. And what the Kidney-PREM, which stands for Kidney Patient Reported Experience Measure, what the PREM is trying to do is measure the experience of care. So this can be reviewed alongside other more traditionally measured outcomes, such as clinical outcomes, through the UK Renal Registry. So the Kidney-PREM is steered through a national working group, and this is a really fantastic group of people bringing together a wealth of experience and expertise. For example, members of the Renal Association Patients Council, clinicians, academics, nurses, and representatives from the Kidney Care UK charity. And the delivery of the national PREM is co-funded 50-50 by the Renal Association and Kidney Care UK. So whilst experience, we think, should be seen as an equally important measure of quality as clinical outcome, clinical effectiveness and safety, it is a more nuanced measure and can be difficult to capture. So today we're describing the way we as a kidney community gather and present experience on a national scale, and then how that can be used as a springboard locally for more focused, tailored interventions and improvement. And it's really important to note that this measure is really only a signal of what matters to people. And the most important thing is to talk to and listen to patients and involve them in any service improvement work. So the Kidney-PREM all started back in 2016 through a quality improvement programme called Transforming Participation in Chronic Kidney Disease. And I'm going to hand over to my colleague Claire Corr, who has been involved in the development of the Kidney-PREM right from the beginning to describe the process.
Over recent years, the idea of co-production for research has been developing, and one of the first big national studies was TP-CKD, or Transforming Participation in Chronic Kidney Disease. We had 2 overall chairs, 1 patient, 1 professional, and then 3 work streams: measurement, intervention, and commissioning. Again, each were led by a patient and professional. Each committee was then made up of 50% patient carers and 50% of others who were made up from people from healthcare professionals, the renal registry, or academic backgrounds. I was the co-chair of the measurement workstream with Sabine van der Veer, a researcher in health data science, as the other chair. Whilst looking at the PREM, we found that what is important to professionals is not necessarily what is important to patients. So the initial challenge we had was that the professionals on the team, not used to having patients there, wanted to take control. But the patients felt that they knew better as to what they thought were important experiences, which needed measuring, such as transport. Thankfully, it was agreed that we all work together, and after several large spreadsheets, we finally managed to whittle it down to a more manageable number of questions. And in 2016, the first national renal PREM was produced.
So Claire spoke about the measurement workstream. The workstream identified 12 areas of kidney patient experience, which initially were covered in detail via 43 questions. Kidney-PREM was piloted in 2016 with paper copies sent to renal centres in England, which exceeded all expectations and returned more than 8,000 responses. We at University of Hertfordshire did some work to validate the Kidney-PREM in 2017, ensuring its robustness and reliability as a measurement tool. This included an analysis of the 2016 data to ensure that questions fitted together in their themes and that there were no repetitive or unnecessary questions. We also did some cognitive interviewing with patients where you ask people to explain what they're thinking as they go through a questionnaire to ensure that they were interpreting and answering the questions as they were intended when they were developed. And we did a separate test of the Kidney-PREM with patients in Wales, looking at stability of the measure over time. As a result, it's quite interesting to see how Kidney-PREM has developed over time from 2016 to the measure it is today. As I mentioned, all 12 themes that were considered important in 2016 still stand, with the addition of another, needling, in 2017, which has made it a 13-theme measure. The number of questions has varied during the validation process, expanding in 2017 and then being refined to a stable 39 questions in 2018. Kidney-PREM was only available in paper in 2016 and then online with further language options in 2017. In 2018, we added the option to leave a written comment in the online survey, which last year had a permission box attached to tick if patients are happy for their unit to receive their anonymised text. The analysis of the 2019 written comments is available on the Renal Association website. The Kidney-PREM's grown in reach from an English measure in 2016, extending to Wales in 2017, and then some patients from renal centres in Scotland came across the survey on patient view and completed it, despite Scottish centres not officially taking part until 2018. For the last 2 years, the survey's extended across the whole of the UK, and the Kidney-PREM has grown year on year to more than 16,000 returns in 2019. So the Kidney-PREM measures the experience of all groups of patients with kidney disease, from pre-dialysis through all renal replacement therapy modalities, including transplant, and those who are conservatively managed. There's a short introduction on the first page, a few questions on demographics, including age, sex, ethnicity, and treatment modality, and then those 39 questions about patient experience of renal care. And then finally ends with an overall experience question. Themes include transport, shared decision-making, communication, diet and fluid, a real cross-section of themes that were important to patients and clinicians back in 2016. Patients rate their experience of the various aspects of kidney care on a scale of 1 to 7, or never to always. Kidney-PREM goes live each year in June, although it has been postponed this year. Paper copies are distributed via renal centres with a link available to an online version, which is also available to patients using Patient View. The online PREM is available in Welsh, Gujarati and Urdu, as well as English, and as I mentioned, includes an open text box so that patients can provide further comment about their experience if it's something that they don't think is adequately covered by the PREM itself. The measure is completed anonymously. There's no patient identifier. There is a space for the unit to enter the Renal Association assigned renal unit or centre code, which is now pre-populated by registry. So we can't tell which patients have returned PREM, but we can tell which centres and units they come from. The process is fairly straightforward. All hard copy Kidney-PREMs are returned to UK Renal Registry by courier from centres for checking and scanning, which produces a significant data file, which is then subjected to some initial checks by registry. This is then merged with the online PREM data at University of Hertfordshire, because we host the online PREM, and we do the analysis and prepare a draft report for the consideration of the Kidney-PREM working group. We report on means, considering a difference of more than 10% of the scale score, so more than 0.7 to be noteworthy. The results of the Kidney-PREM are available each year online and in hard copy. Renal Association and Kidney Care UK have also historically sent unit level data directly to centres so that you can see what matters to your patients, both at unit and also aggregate centre level. This is moving online to the PREM data portal, which Catherine will speak about in a moment. So in terms of the results, I'm just going to look at the demographics on this slide and then move on to areas of experience in the next slides. In 2019, there were nearly 16,500 valid responses from patients attending 70 adult renal centres across the UK. Just more than half of participants were males. The single largest age group was 56 to 74s. The majority of responding patients were on hemodialysis, although having said that, there were response rates, decent response rates from those on peritoneal or who have been transplanted or attending low clearance clinic. And most patients completed the Kidney-PREM in hard copy in English. So as you can see, this is the mean scores by theme over the last 3 years. Patient rating of overall experience has remained high 3 years running. So this year it's at 6.3 out of 7, very high score. And in terms of themes, privacy and dignity, access to the team, patient information, and scheduling and planning continue to be areas scoring most highly. In contrast, issues which we, again, consistently see impacting most negatively on patients continue to be transport, sharing decisions about your care, hemodialysis, vascular access needling, and support. These themes also report the highest levels of variation between centres, which I'll come on to in a moment. So this graph shows centre results for the question, how well would you grade your overall experience of the service provided by your renal unit on a scale from 1, worst it can be, to 7, best it can be? And I've just included it as an example of the type of information available to you. In terms of local results, a consistent message of the Kidney-PREM Working Group, UK Renal Registry and Kidney Care UK has been that PREM will have the greatest impact when renal centres further investigate and act on their local findings in partnership with patients and make improvements to care identified as necessary by their own patients. There's a note of caution associated with making comparisons between centres, so differences in response rates and differences in patient profiles mean that directly comparing yourselves against each other may not always be as informative because we don't know, for example, whether any differences are down to things like sampling. And you can always review how you're doing against the national average using the graphs in the national report and the PREM portal. However, what it is worth noting, and it's shown here, centre scores falling above or below the quartile ranges, where the confidence intervals fall entirely below the 25th or 75th centiles, they are likely to indicate patient experience outside of that normal range. And potentially there are opportunities for centres performing well in an area to share knowledge and ideas with those performing less well or those in the middle who are aspiring to greater things. This is quite interesting. This is particularly true, so the centre effect. So there's been a consistent finding year on year in the annual Kidney-PREM that centre differences are more closely related to patient experience than any other characteristic measured in the PREM. We've analysed the data to see what impacts most closely on patient experience, and while age, treatment type, treatment location, ethnicity and sex have a small effect, they're much less important than the treating centre when determining a patient's experience of renal services. So to look at this in more detail, each year the Kidney-PREM has shown considerable variation between centre means, access to the team, privacy and dignity, patient information are areas in which centre means are high, so these are high scoring areas in centres, but also each of them have a very small range of centre means, so there's actually not that much variation between centres and units and everyone's doing quite well. Tests, scheduling and planning also have a narrow range of means and score well at 6.2. But then on the flip of that, transport, sharing decisions and needling have had consistently poor experiences reported each year and have wide ranges of centre means that suggest the overall means are reduced by the centres with patients who report worse experience. Support has dropped slightly to a mean value of 5.8, down from 6 in 2017. It's also noticeable that how the team treats you at 1.8, fluid and diet and communication have consistently wide ranges of centre means, which indicates that these areas could benefit from a focus on understanding variation between centres. So to go back to that, how the team treats you, there's 1.8 scale score difference between the lowest performing and highest performing centre, 1.6 for diet, fluid and diet, and 1.7 for communication. So approaching 2 scale score points for each of those between the best and worst performing centres. So again, that's something that could benefit from being looked into more greatly. I shall now hand over to Catherine, who will talk to you about accessing local data as required to engage with some of these differences.
So there are a number of ways the results of the Kidney-PREM are presented. Janine's taken you through the national report, but there's also an online Kidney-PREM portal where units can look at their data question by question and at a unit level rather than reviewing a whole service. So this is just a screenshot to show you what the portal looks like. And I've blanked out the unit names here, which is why there's blue boxes around. So what you can do is select, you can select down here on the right-hand side the year you want to review, or you can select multiple years to look at changes over time. You can select the region that your unit falls within, and then the main service, and then you can look and select different sites. So this, for example, this is showing a question on fluid intake and diet. And you can see here within one service, there's variation from the way patients responded across the different units. What you do have to be careful with are small numbers. So this is showing as a percentage of all the responses for that question who responded with 1, 2, 3, 4, 5, 6 or 7. If you hover over the blocks when you're on the portal, it will tell you the number of responses that that's referring to. So what units can do is, from the national report, you can look at each theme and see where your unit might fall in the lower 25th percentile or the upper 75th percentile, where you may be performing slightly worse or slightly better than the national average. And from that information, you can then look further within that theme to think about what the particular issues might be. So for example, this is the transport theme, and you can look at responses to the different questions within that theme to see where the key issues are to be addressed. So this is showing 2 trusts, one performed in the top 25th percentile and one in the lower. And you can see that being able to leave within 30 minutes after treatment is a particular issue. And you might want to learn from the unit on the right-hand side, or get some ideas from them as to how they're managing their transport to improve. And what the Kidney-PREM group is really keen to do is to inspire quality improvement that is focused on patient experience, and so we can really embed the patient voice into improvement. And to do that, what you need to do is review and share your local results. You need to talk to local patients, involve, for example, kidney patient associations, and get staff on board. And then you need to prioritise the key areas that you want to improve. And I just wanted to mention here the Kidney Quality Improvement Partnership, which is available for renal teams. And there's an online K-Quip hub with lots of resources, case studies, and e-learning around quality improvement. What the PREM group would love to do is collect stories of where the Kidney-PREM has inspired change. And we think it's really important that patients are involved in this. They often have to fill in lots of surveys and then may not see the results of those surveys or any change that it's impacted on. This poster is available to download on the Kidney-PREM website, and it's a template poster that units can fill in with their specific scores from different themes, the number of patients who responded from their unit, and then down here at the bottom they can put in their quality improvement plan, so how the Kidney-PREM has impacted at their unit and what they're doing in response. And I just wanted to share with you a case study from King's College Hospital. This is one example of where the Kidney-PREM has been used to improve experience around transport. So they saw through the Kidney-PREM that transport was a real issue. They decided to hold regular meetings with their transport provider and with patients. They worked regionally to swap patients across trusts to improve patient journeys. They created transport champions at each unit and then captured weekly data on transport incidents across each unit. And this all led to a reduction in adverse incidents and a much closer working relationship with the transport provider. So that's just one example of where the Kidney-PREM has inspired change. And now I'm going to just hand over to Claire Core to finish, to talk about where we are now with the current situation and what that means for kidney patient experience.
How has coronavirus and the disease COVID-19 affected patient experience? Well, this is not something that we have measured yet, we thought you might like to hear about some of the things that are concerning patients. One of the biggest negatives is the suspension of kidney transplant programme. As dialysis is seen as an alternative to kidney transplant, transplant itself for kidneys is seen as not an emergency operation. But not everyone has the luxury of just waiting on dialysis and keeping well. This is something I hope will be resolved quickly, and I assume most patients wish that to happen. People are having to wait longer for transport to both dialysis and clinics, as due to social distancing and self-isolation, only one patient per car or ambulance is allowed. But there are less people going to clinics now, as virtual clinics, thought in the past not to be a good idea, are now a reality and will hopefully continue after things have got back to normal, so people won't be doing the travelling that they once did. Hospital dialysis has more personal limitations, with patients often having to wear face masks at all times, which makes eating and drinking very difficult, and social interaction between them and the staff and the patients between each other not happening. However, more patients are checking up on each other, getting in touch with people they haven't spoken to or seen for ages, and concern and help is being given where needed, mainly by social media, but also telephones. Several patients have commented on difficulties getting their medication. With no azathioprine in my town, I had to contact my regional hospital to ensure I got a supply. I know I'm not the only one, with people commenting on shortages of several different drugs. But this has meant that people are taking more responsibility for their own health and ensuring they kept their stocks up. Everyone is self-isolating and shielding, with transplants being classed as the highest risk group. There again, transplant recipients are used to keeping away from people and can probably show everybody else how it's done. Research has been hit hard. Universities are closed down with little practical research going on. New research licenses are being put on hold as all efforts are turned towards a cure for COVID-19 and a vaccine against coronavirus. But as these things are pushed through quickly, might it open up new pathways, showing how results can be achieved quicker, with less bureaucracy involved, as people all pull together for the best results. Whether or not COVID-19 will be added to the PREM next year is still unknown, but patient-reported experience measures are still important, and a revised PREM will be seen either later this year or next year. Thank you.
Thank you so much for listening. If you'd like any further information on the Kidney Patient Experience Measure, do get in touch with me by email. My email is on the slide here, catherine.stannard@renalregistry.nhs.uk, or you can visit the Kidney-PREM website which is listed on the slide. Thank you.